Kushe, and good evening, everyone. This is John Lasher from Partners in Health Sierra Leone, and today is Monday, June 8th. There are now over 1,000 coronavirus cases in Sierra Leone, most of which are in Freetown. Since our last update, the numbers of cases in Kono have continued to rise. There are now 22 confirmed positive coronavirus cases in Kono District. Most of those cases are being treated at Koidu Government Hospital, but we did just open a community care center this weekend in collaboration with the District Emergency Operations Center and the District Health Management Team. We'll be providing further updates about that community care center in another audio update this week. Last week, the President and Minister of Health of Sierra Leone came to visit the Sierra Leone Psychiatric Teaching Hospital to commission and celebrate the completion of much of the infrastructure work that Partners in Health has been carrying out over the last couple of years. And as I was preparing remarks for that event, I was thinking about the moment in history that this event was taking place. And it was difficult to know I was going to be making a public speech and not acknowledge what was happening in my home country, the US. And so before we jump into the interview portion of the audio update, I wanted to share some abridged remarks from my speech at the Sierra Leone Psychiatric Teaching Hospital. I feel it is important, especially as a white American, to comment on what is happening in my home country. And what is happening in the United States cannot be delinked from what happens in Sierra Leone. The shameful history of America's slave trade is inexorably connected to the story of Sierra Leone. Our two nations are bound by a history of injustice, the consequences of which are still being felt on both sides of the ocean that separates us. 16% of slaves that were stolen from Africa and forcibly brought to America were from Sierra Leone. Though some argue slavery in America ended long ago and that it is now time to move on, the systemic racism that persists in the U.S. is directly related to the very recent history of slavery and Jim Crow segregation. The aftershocks of slavery and colonization are still playing out today. Americans aren't alone in grieving the senseless murder of George Floyd. The story of injustice towards Black people in America is long, and sadly its final chapter is still not written. Americans are taking to the streets in order to demand justice from those in power in the U.S. to dismantle the racist systems that allow white police officers to carry out state-sponsored murder without consequence. At Partners in Health, our mission as an organization is to make a preferential option for the poor in healthcare. That means we prioritize those who are suffering the most. We say that the most marginalized should be first in line to receive the benefits of our society. The mission of a preferential option for the poor shares common cause with those demanding justice across America as part of the Black Lives Matter movement. At the Sierra Leone Psychiatric Teaching Hospital, a place where a few years ago patients were chained to beds, it would be easy as an outside observer to think that Sierra Leoneans were okay with this. But at PIH, we reject simplistic analysis. We know that systemic racism also plagues global health and international aid. The same countries that have benefited from centuries of bounty from Sierra Leone are the ones suggesting what is and what is not possible for progress in this and other impoverished nations. It is possible to unchain patients if you have support that is directed towards your priorities. When you appreciate that more than 90% of mental health resources are spent in high-income countries, where only 20% of the world's population live, the challenges facing mental health programs in poor countries become more understandable. I want to thank the whole staff of Partners in Health and the Ministry of Health and Sanitation in Sierra Leone for showing the rest of the world what health leadership looks like in the face of unfathomable challenges and scarcity. Up next, we're going to hear from three members of the team that have been instrumental in the transformation of the Sierra Leone Psychiatric Teaching Hospital. The medical superintendent, Dr. Abdul Jalloh, who happens to be one of the only psychiatrists in Sierra Leone, Umaru Sharif, who is the operations officer for Partners in Health Sierra Leone, and Alpha Sesay, the infrastructure team site supervisor at Sesay. Hi, Dr. Jalloh.
Hi, John. How are you?
Good, good. Can you introduce yourself to the PIH team?
My name is Dr. Abdul Jalloh. I'm the psychiatrist in charge of the Sierra Leone Psychiatric Teaching Hospital.
How long have you held that position?
This is my third year from 2017 to date.
What made you want to become a psychiatrist?
Long story. It started during my undergrad fourth year when we were posted here. I saw the way the patient we have been treated by the only psychiatrist by then, Dr. Naim. So and again, out of out of love for humanity, then they developed the interest in psychiatry.
What was, when you were starting to develop an interest in psychiatry, what was the state of mental health care in Sierra Leone?
I, it was very bad. It was very bad, very bad. The hospital was in a almost in a collapse state. Dilapidated infrastructure, no water supply. There was nothing, absolutely nothing. And then this hospital being the face of mental health in Sierra Leone, if this hospital has such problems, what about the other part of the country? So the state of mental health by then was in a state of collapse. Nothing whatsoever was happening.
Can you talk a little bit about the partnership with PIH?
The partnership with PIH has been very, how can I say, very strong, cordial. Everything good has been happening with the partnership. And PIH has been supporting this hospital from 2018 to date. And the support is self-evident for everybody to see. Because now, before we don't have water, but now we have water. There is medication. The hospital has been upgraded to a modern teaching hospital. A lot of things has happened as a result of the strong partnership with PIH.
And how has the COVID-19 outbreak changed mental health care at this hospital and across the country?
For the COVID-19, one, it affects us because most of our patients, they don't come for follow-up because of the fear of catching, of getting the COVID from the hospital. And secondly, also, we have patients who are living up country. Some of them have been stuck. They can't come for their follow-up visit and to get their medications.
Do you want to just explain the visit we just had last week?
The visits of His Excellency the President, retired Brigadier Dr. Julius Madabio, is unique in the sense that he is the first head of state to visit this hospital, to commission this hospital since 2006. But the visit with the difference between these two visits is this one is to commission as a result of the strong partnership between PIH and the Ministry of Health. Whereas that visit by the late President Ahmad Kaba was to reopen as the hospital with funds provided solely by the Islamic Development Bank. So and also this visit is as His Excellency said, it's part of their manifesto, mental health. So it to showcase what exactly the government is doing in terms of mental health, and then also to destigmatize mental health in the country.
Are there any final words you can share with our team about mental health, or really anything you'd like to share with the PIH team?
Yeah, I just want to extend our appreciation to the PIH team, both here and abroad, for the support and we pray that PIH will continue to support us and will continue to stay in Sierra Leone forever and ever. Amen. Thank you.
Thanks, Dr. Jalloh. Hi, Sharif.
Hey, hi John, how are you?
I'm good.
Yeah, I'm good as well.
So, Sharif, can you tell everyone what your role is at PIH?
Yes, I'm the operations officer, seconded to Sierra Leone Psychiatric Hospital, and I worked half hours in the I work like 2 hours a day in the PIH office sometimes, and I also work in Sierra Leone Psychiatric Hospital like 24/7. I'm here like to support all operations and the hospital, to support clinicians and to support infrastructure works that are supporting the mental health care.
How long have you been working at this hospital?
I came in 2018, just after the partnership was established between Partners in Heart and Sierra Leone Psychiatric Hospital.
And how do you see the partnership?
The partners is amazing. Dr. Jalloh has been a person that is very accommodating, and all the administrative staffs and clinicians are also accommodating. They are really, really happy about our being here, and they are making our job very easy because they are open up and receiving us, and we coordinate and put IDs together in order to develop the facility and in order to provide better care for patients. And it's good. To me, the partnership has been a awesome one.
How did you see the event last week?
The events last week is amazing, and I on behalf of my team, I extend thanks to PIH operations team, especially procurement, finance, for their support in supporting us to achieve this this happy and this one-time event, and especially regarding the president visit to our country, which is very amazing, and which is very for me is an achieving. It's very achieving for me because it's amazing. It's very, very amazing. An infrastructure team that did very well, and we all coordinate together, including Dr. Jalloh and all the staff within here.
What's been your favorite thing about working at this hospital?
The way we came here and the way how we saw the patients and now how the patients are recovering. Firstly, when it came here, you see a patient will be an inpatient like for 2 months because there was some better medications, and most of the medications that was expired. And when we came in, there was a new medication supplied, and now you can see a patient can take 2 weeks here and it's discharged, a week and it's discharged. And we have large number of outpatients than the inpatient, and which is very amazing. And we are also supporting with the social workers. We have volunteer social workers who are supporting to make sure to reduce the relapse cases that we have, and which is very amazing. I have a lot of amazing things to talk about, but I cannot end them today if I want to say them about. Yeah.
Thanks, Sharif.
Thank you very much, John. Thank you for the interview.
Alpha, thank you for taking some time. Can you please introduce yourself?
Yeah, I'm Alpha Sesay, the infrastructure site manager, Sesay Psychiatric Teaching Hospital.
Can you tell us about the different jobs you've had at PIH? Can you tell everyone at PIH about the team of PIH staff that support this hospital?
Yeah, well, actually, at first I want to say thanks to the leadership of Partners in Health, especially to the executive director, John, because if you have the right man on the right place, I believe we can achieve our goal. And one thing about the PIH infrastructure team, both in Kono here and Laka, we do work as a team, and because of we work as a team, we are able to achieve most of our taxes and the rest. And with the support of also Umaru Sharif, who has been serving as operations officer to make sure that everything goes well. I believe due to our hard work that brought the President of the Republic of Sierra Leone, in this of our hospital.
And who are some of the other, how many staff from PIH work at this hospital?
Well, as of now, we have something like 9 staff that is working with PIH to make sure that we monitor and make sure that things go well. We are here to make sure we do work with the policies of the organizations and also work with the policies of the government, because we do work hand in hand to make sure that at the end of the day we achieve our good aims and our objectives.
What do you, if you could share maybe one final thought with the PIH team about the work at this hospital, what would it be?
Yeah, I believe the work that will be done has been one of the most successful jobs in Sierra Leone, because after the whole exercise, to see the President of the Republic and Sierra Leone ministers and other, and other dignitaries, I believe as a site supervisor, I was so happy, I was so impressed, because I believe I've done a lot, and I believe with the inspiration of the leaders, the leading team of PIH, also the leading team with my able boss, who is Douglas, I believe we have to do more. We have to do more, and I believe we are ready to learn, and every day we learn new things, and every day we implement new things.
Thank you so much, Alpha.
Thank you, John Lasher, our Executive Director, Sierra Leone.
What's keeping you motivated?
Well, actually, what kept me motivated at first, the organization that I worked for kept me motivated. I've been working with different organizations. I've been working with some government people, but sometimes the way they work with us and the way and what I've learned from PIH, I've learned a lot. And I'm always praying that as from now on, I've sacrificed myself, that I'll always make sure I work with PIH to make sure that we achieve more goals for the Republic of Sierra Leone. And I'm also glad because I'm a Sierra Leonean. I need to show them my mentor given by God to me, and also with the support, with the coaching, and also delegating responsibility to me, which made me, I am so proud, especially with the team of the infrastructure.
Thank you, Alpha, and thanks to the whole infrastructure team.
Thank you, Big Boss.
Thank you to Dr. Jalloh, Umar, and Alpha for making today's audio update possible, and more importantly, for helping to transform the hospital in Kissy. As well, we'll have another audio update this week celebrating the opening of the COVID-19 Community Care Center in Kono District, which received its first 5 patients over the weekend. I hope everyone's having a great start to the week, and I'll talk to you soon.